Hey everyone, welcome back to another episode at Peak Human Labs. I'm so excited because today I get to talk about a treatment that I just completed, and I think it is the next best secret for women's pelvic floor and even for sexual function and pleasure. So thank you both for introducing me to my secret machine. Why don't you share with everybody what it is?
What we're offering at the clinic is a treatment called Emsella, and it's basically a magnetic stimulation of the pelvic floor. And I'll let Michelle speak to it a little bit more. But basically, it's really shown amazing results in women who have urinary stress incontinence. That's really where it started, and you said there's some benefits.
There's some other sexual benefits.
But that's really where the benefit really started. So if you want to kind of explain the machine, how does it kind of work?
Yeah, it's a chair. You sit on it, fully clothed. You can read a book. You can be on your cell phone. You could talk to a friend in the room. There's two protocols. Protocol 1 is for urinary incontinence, even urge as well. So that's when you gotta go. You can't hold it. And Protocol 2, which is a little stronger, a little different. That's for sexual dysfunction. So that kind of brings the blood flow to the area, and it helps with things like sensation. So,
yeah.
And even in men, apparently. I think, isn't there some studies that it was also in men that have better orgasms or ejaculations?
So men can sit on it too?
Men can sit on it too.
Yeah,
Oh.
Because what happens, the men's also pelvic musculature gets weaker as well.
Oh, because it's right underneath.
Contract.
What's the area between the anus and the scrotum? I'm being technical here.
In women, it's the perineum.
Yeah, the perineum. Okay, great.
Perineum, yeah, that is the area that's where we want the contraction to go.
Yes.
Got
that
it.
muscle that's between there, and that muscle is responsible for closing the bladder.
Right.
But it's also involved in orgasms.
For men and women?
Yes.
Okay. Well, I just want to share with those who do not really know the term urinary incontinence, right? It basically, let me explain it. You're jumping and you want to pee. You laugh and you pee a little bit, right? Like you cough and you pee. Like my mom is in her late 70s and she's now wearing... sorry, Mom. I mean, she can say that. She's wearing...
Can we get her on the treatment?
Yeah.
I didn't know that.
Oh, yeah, she's wearing... She's wearing depends like elderly diapers.
Yes.
Just because or sometimes she's moved from pads to diapers now because she has that issue. So why didn't I do that? So that's the case. And I don't think, to me, I started experiencing that I think probably in my 40s, and I probably then had already I've given birth to 3 kids. And so is there something about childbirth that actually impacts the bladder? Because I know that when I've got this big baby on me, like it puts a lot of pressure on my bladder. Is that why women post-delivery have incontinence more than others? Or is that just a genetic thing?
Yeah, it's not just that. There's so much weight on your pelvic floor. Like imagine your pelvic floor is like a cup, like my hands, and then the pelvic floor is holding like your bladder and your uterus and all this, and with the weight of the baby, it starts to droop. And as it droops, that's when you get incontinence.
Okay, so unless you're doing your GOEL'S, which I'm doing right now, you can't even tell, that helps, but it's not going to give me 11,000 GOEL'S in 30 minutes or 5 minutes, 1 minute.
28 minutes.
No, and I think when people
I can't even do
Kegels,
it fast enough. I'm trying.
the key word is supra-maximal, if you want to kind of explain.
Okay.
These are not Kegel. They're not Kegel exercises per se. The machine is doing supra-maximal contractions.
Yeah, so that's not humanly possible.
So you can try all you want. It's never, you need the assistance.
Yeah, you can't mentally contract your muscles. If you just try contracting your pelvic floor muscle right now, it takes some effort, and you're not contracting all the muscle fibers like this machine is doing.
Okay. I think a lot of women who, first of all, when you see the machine, it's just a chair.
Yes.
You can't even tell that it's on until they turn it on. And then it's like, what fear do most women have around this machine?
Honestly, I don't really think women have much of a fear. A contraindication obviously is pregnancy. You can't do it when you're pregnant. Another one, because it is a magnet, you cannot have any metal implants in
Like a hip replacement.
yeah,
Oh,
in the
okay,
hip area. But we started off with positioning the patient.
You can even be in different positions on there?
Yeah, so we it's like a little ticking sound, and it
Okay.
just is like a little pulse. And what we do is we tell them some women need to spread their legs open a little bit. We tell them we want them to feel it from the end of their vagina to their bum.
So there is certain placement that,
Yes.
yeah, okay.
Yeah, and then we start the treatment, and we go slow because it goes to about 100%. And we slowly go up, and as long as they're comfortable, we can keep going to 100, and then they're good once they're there.
Yeah.
Sometimes women ask, do they need to repeat the treatment? So what's our experience with that, like, maintenance and things?
Yeah, after their 6 sessions, because everyone is different, I say to them, you have to monitor yourself. Everyone's different. Some people may need maintenance more than others. And once you start to feel like you're leaking a little or the urgency comes back, then come see us. They don't have to do the 6 in 3 weeks. They could do it once a month, and that's good enough for them.
What I'm curious about, aside from the fact that you're tightening your pelvic floor, but are you actually tightening the vaginal canal as well? Because how does it improve sexual function for women who, is it for treatment for low libido?
No, it won't impact libido, because libido is mostly a hormonal issue.
Okay.
But so the vagina is mostly all smooth muscle. It means you can't actually contract the vagina, but the muscles around the vagina, which are all the pelvic floor muscles.
Okay.
So you can imagine that when someone's having an orgasm, there's all these contractions that are happening.
Right.
That's your pelvic floor muscles. That's not.
Got it.
So those are actual muscles that we can mentally contract.
Okay.
Right. So those are muscles getting stronger. So then people's orgasms can be stronger.
Because there's more
Contraction.
tightening.
You can feel it. You can have
Right.
more. You can have more of a sensation.
I think the pleasure is more for the men then, don't you think?
Oh, you mean if the women's having the orgasm?
Yeah, well, yeah, because if it's helping with the tightening, then better grip. So just explain what a Kegel is, because sometimes people don't know what a Kegel is. If you were actually to think or consider, if you were having intercourse and there was a penis inside you, and the practice is to squeeze on it, right? Or even there are Kegel balls. Have you heard of that?
Yeah, I've heard of it.
You've heard of it?
Yes,
Okay, so these Kegel balls are actually made of, I think they're sterling silver, so it's safe to put in and has to be sanitary. They're slightly weighted because the trick is to keep them inside, right? So you can't wear underwear. So you got to stand and keep them inside, because if they slip, that means you've got a looser pelvis. So you just want to squeeze. And I kind of relate it to even, when they, as kids, when you pick the ball between your legs, only it's deeper. Yeah, it's inside. Try to keep that tennis ball inside. Or if you had to go to the bathroom, I think the same pressure to hold your bladder.
Yes.
That's a Kegel,
And
isn't it?
That's exactly
That's
why.
I gotta pee. Ooh, you squeeze.
That's
right?
why the machine works, because you're in
Okay.
effect strengthening that muscle that makes you stop peeing.
Yeah.
Yes.
Exactly, that's the issue.
Yeah.
That those muscles get weak.
And for sexual dysfunction, in terms of protocol 2, for example, it's stronger. It's actually bringing more blood flow to the area. So for women, it actually helps.
Sensation.
Yeah, it helps
Yeah.
sensation.
I relate that to the gym, where when you're standing on that machine that's doing this for blood flow, I don't know that it's doing that magnetic, but it's kind of like that on your vagina, right? I didn't know it was made by magnets. I thought it was electricity. How is it made by how is the magnet?
Yeah, it's
working?
electromagnetic.
Electromagnet. Okay.
Yeah, so it means that if you were to put your hand on it, you're not gonna feel like.
Oh, there's no
buzz.
electrocution.
Yeah, it's
right.
not gonna have not like a TENS machine, a
Right.
Dr. Ho machine.
Yes. Okay. Yeah.
That
yeah.
is a complete that's electric.
Right.
Whereas this is
Magnetic.
means that unless there's muscle there to start contracting, you will not feel any buzz.
Right, so there actually isn't a shock, is what you're saying.
It's not electricity.
You don't want to shock your vagina, so that's a very good thing. I'm glad that they made this. That was my concern, actually. You know what? That was my concern because I didn't know what electromagnetic is, and I'm like, I've done Dr. Ho, so am I going to, like, all of a sudden feel that electrocution? But you don't, and it's over clothing. So do you recommend women don't wear jeans? Like, they should wear, what should they wear? Ideally,
they could wear jeans if they want. Preferably, we want
like a thinner
tights. Yeah,
tights. Okay,
tights. Just because it's less fabric.
Okay,
Yeah,
that's great. And any other for me, I did my 3 sessions. I've not had an issue. I'm far from getting diapers, but I don't think it's something to be embarrassed about. I think that this is an important treatment for ladies. I think some ladies might have shame around the fact that they cough and pee. I know comedians talk about that all the time. It's like, but when it happens, like sometimes you carry extra underwear, you're wearing, you got to bring a pad. And so for ladies, if you're out there and you're having this issue and you're silent about it, because how many women are not talking about this issue or thinking it's just them, like, why am I peeing, right? So I really love that you're bringing this up because for those women who are having that issue, talking about sex, talking about sexual dysfunction or anything wrong is often taboo. Do you find that? Do women come because they've been recommended by a doctor?
I find that women go to doctors for other things and they have urinary incontinence and they just don't mention it because they're embarrassed to. They don't know if there's a treatment.
Yeah, most doctors are not aware, and traditionally we have given medications to help make that valve stronger, which have all types of side effects and don't work that well. And so the treatment is not very good. So I think women just get discouraged. What's the point of bringing up something that has no treatment and I'm not ready for surgery? So I think what we want to communicate out is there is good treatment. It's non-invasive.
It's actually quite pleasurable. Ladies.
I knew that you would bring that up.
It is pleasurable. Put in your headphones. I listen to my sexy music.
We close the door for a reason.
I listen to my music, and it is the best massage for your female area that, you walk out feeling a little flushed, thanking the doctors. It's great. I think, you should shut the door and let them relax and enjoy it. It's your me time. It's your medical spa for your area.
Well, yeah, I think we take care of the rest of our muscles. We forget that the pelvic floor is such an important muscle.
Mm-hmm. We forget it's a muscle, period.
Yeah, exactly. Like we talk about core strength. Core is really important.
Yes.
The pelvic floor is part of that core strength. Really
Thank you. Well, where does everyone get a hold of this machine? I don't want men on it. It's going to take away from my time. But anyway,
go to
I got to share.
Yeah, it's peakemsella.com. So peak, P-E-A-K, Emsella, E-M-S-E-L-L-A.com. Please, there's a form on there. Just send us a message. We'll give you a call, get things sorted out. You'll have an appointment with myself. We'll go over your history and make sure you're a good candidate for the treatment.
Yeah, and I think even if you don't have incontinence, it's a great way to make sure you never have it.
Yeah.
And some me time. Thanks, guys. If you like and subscribe and you have anybody that you think would benefit from this information, not often talked about topic, there are solutions to tighten your pelvic floor, and Peak Human has them. So, till next time.
Take care, everyone.
Thanks.
Bye.
Bye.